Hello, good morning. I'm Dr. Srinivasan Paramasivam. Namaste to all of you. I'm a neurosurgeon and neuroendovascular surgeon at Apollo Hospitals, Chennai. What exactly is neurosurgery and what exactly is spine surgery? The surgery we do for the brain and spine problems. Not everybody who has a problem in the brain and spine needs a surgery. There are some few specific conditions which we treat by surgery. Predominantly, if it is a structural problem, we generally treat it with surgery. For example, somebody who has a trauma, accident, they will need urgent surgery if there is some fracture to the skull which is going and poking into the brain, or there is a bleeding within the brain. The problem with the brain is it's a closed cavity. It cannot expand. Any fluid collection inside or blood collection inside needs to be operated and cleared. So that is a very common type of surgery we do. But today we do surgery for a lot more things. Somebody who develops a chronic headache, if you have a headache which is going on and on for months and progressively increasing in severity, then that needs an evaluation by a specialist with a CT scan and MRI scan to find out what is wrong, and based on what we find, that may need a surgery if we find a tumor. Tumor can also present with abnormal loss of consciousness. They may develop loss of consciousness with twitching of hands and leg. We call it as epilepsy or seizures. If they develop a seizure, then that needs to be fully evaluated and we need to treat. Apart from these symptoms, patient also sometimes present with little bit of giddiness and progressively difficulty in walking. Those are also symptoms of brain pathology. There are other diseases we treat, like blood vessel abnormality. That is, we have the blood vessel going to the brain. Okay, we have two blood vessels. आगे से दोनों blood vessel है, पीछे दोनों blood vessel है. These blood vessels may develop a balloon, and if it has a balloon, it's called aneurysm. This aneurysm can cause major bleeding inside the brain. That also can be treated by two ways. That is, one type of treatment is doing a microsurgery and clipping, going from outside. Other modern treatment is a pinhole surgery. Pinhole surgery means going inside the blood vessel and do endovascular coil embolization. So that is a pinhole surgery. There are a lot more diseases we treat. There are some newborn babies born with a brain tumor, newborn babies born with swelling at the back. It's called meningomyelocele. We treat with surgery. That is, a microsurgery is done, and during surgery we continuously monitor the nerves and then we make sure every nerve is preserved and then we operate. Then there are a lot more other problems like old age problems. Old age problems, predominantly the spine problem. They may develop a neck problem or a low back problem where they have chronic pain. If the pain is there for lot many days, then you need to be evaluated for spondylosis. If there is spondylosis, most of you are treated without surgery, just by medical means. But if it is severe, then you may need a surgery either from the front or from the back to fix the problem. Apart from that, people in old age, they may also develop collection of fluid in the brain. That is called normal pressure hydrocephalus, which is very common. They present with difficulty in walking. Then memory problem. They think that he is old age, so memory problem, but they need to be evaluated properly, and if we can tap the fluid and put a shunt, they will have complete relief. Apart from this, we also treat acute diseases. Somebody with a stroke, anybody with the blood vessel block is called a stroke, or anybody with the bleeding inside the brain, it's also called a stroke. And if any of these stroke happen, they need to be evaluated acutely, and most of them can be treated effectively. They can be saved. They can recover from their stroke almost completely in most situations if treatment is given properly. So if you have any symptoms, like common symptoms you have to understand for neurosurgical disease is headache, if they have loss of consciousness, giddiness, excessive giddiness, or if they have difficulty in using the hand, leg, and difficulty in vision is also a common symptom in neurosurgical problem. If they have loss of vision in one side, progressively increasing to lose vision in one eye, then the other eye gets involved. It may be a sign of a tumor growing behind the eye, like the pituitary tumor. They can be treated completely and effectively if they come early to us. So neurosurgical and spinal disorders can be treated effectively by surgery. And what are the advancements today? During surgery, we use intraoperative navigation. That is, when you travel in a car, you have a GPS. Likewise, during surgery, we have the GPS system, like a computer assisted surgery, where when we operate inside the brain, it will exactly tell us where we are and how far we are from the tumor, and once we reach the tumor, what tumor is left behind. All those information we can gather during surgery with neuro navigation. Then the second advancement is intraoperative neuro monitoring. If you're operating on the spine, then from the brain we stimulate and the leg and hand we monitor. If the conduction is good, the surgery is safe. If conduction is disrupted at some point, then the surgery has to be stopped and then revisited. Then the third one is awake craniotomy. Some patients we operate, especially on the left side of the brain, if they are awake during the surgery and they are talking to us while we are operating on their brain, we know that their function is good. If there is some part of the brain when we touch, if they have a problem in speaking or moving the hands or leg, then we stop there. That makes surgery very, very safe. And the other advancement is endoscopic surgery. Endoscopic surgery may be from the skull or from the nose. So the endoscopic surgery has come a long way. Today we operate a lot of tumors by endonasal endoscopic surgery and by cranial endoscopic surgery. There are also other diseases which we treat, like endovascular. Endovascular, as I told you, it's a pinhole surgery where we go inside the blood vessel and treat the abnormal connections in the blood vessel, like AVM, aneurysm, and other diseases like acute stroke are treated effectively by this endovascular technique. So today, brain and spine surgery is very, very safe. And today we are able to treat a lot of diseases which 10 years, 20 years back, which we thought we could not treat them. We are able to treat them effectively and safely today. And we do an advanced surgery with cutting edge technology at Apollo Hospitals, Chennai. Thank you.